Welcome to this deep dive. We take a complex topic, break down the essential info, and give you the crucial insights.
Straight up.
Yeah, getting right to the heart of it.
Exactly. Today, we're looking at something fundamental to top quality healthcare. How really effective teamwork and, let's face it, well-run meetings power continuous improvement.
Hmm.
Think of this as like your shortcut to understanding how healthcare pros collaborate behind the scenes, to boost patient care and make things work better.
Absolutely. Because in today's healthcare world, things move fast. Progress, real progress, doesn't happen in silos anymore.
Right.
It's that synergy, the energy you get from teams working well together that drives real change. We've looked at the latest thinking, up to May 2025, pulled insights from experts like Dr. Mazen Salama. He's deep into clinical data science, quality management, and also from a really solid guide on team processes, specifically for healthcare quality improvement, or QI. Got it. So our mission today is clear. Really understand how structured teamwork, backed by solid frameworks and efficient meetings. Yes, even meetings become these powerful tools for achieving better healthcare quality and building that culture where things are always getting better.
That's the goal.
All right, let's jump in. How do these crucial performance improvement teams actually get started?
Right, so these performance improvement teams, they're really central to quality efforts. They're needed because, well, they let organizations put focused effort on specific quality or safety issues. Things that might be too tangled, too complex for just the everyday workflow to sort out.
Okay, so they provide that dedicated space.
Exactly, a space to really dig into problems, analyze them properly, and fine-tune how things are done.
So how do they actually, spring into existence? It's not just random, right?
No, definitely not random. It's usually quite deliberate. Our sources show a few main ways. Sometimes it starts formally, like a request goes to the Quality Council.
The governing body for quality stuff.
Pretty much, yeah. They oversee quality initiatives. Other times it's more proactive. Different departments might see they're facing the same challenge and decide, hey, let's team up on this.
Like the ER and the inpatient floors tackling patient handoffs together.
Precisely. That's a classic example of interdepartmental collaboration, finding common ground on a shared problem.
Makes sense. What else can trigger a team forming?
Leadership is a big one. If top leaders spot a major need, maybe it's a new regulation they have to meet, or maybe, unfortunately, something serious happened, a sentinel event.
A sentinel event. Like a really serious, unexpected incident.
Exactly. Involving death or serious harm, those absolutely trigger a focused QI effort. So leadership might say, we need a dedicated team on this now. These are usually high-priority projects with clear backing from the top.
It sounds like leadership's role is much bigger than just giving the okay. They're really setting things up for success.
Oh, completely. Leadership and that quality council, they're vital for validating that a team is even needed in the first place. And critically, they're the ones who can unlock the resources.
Resources like people's time, money, tech.
All of the above. Staff time, which is huge, access to the right technology, maybe specific funding, and crucially, they make sure the team's goals actually line up with the organization's big picture, its mission, its overall quality goals, keeps the team from going off track.
And that clear support from leadership must really affect how well the team actually does its job, right?
Huge impact. There was research in 2023, Smith and others, showing that when leaders are actively engaged right from the start, it seriously boosts accountability. It helps build that culture of continuous improvement across the board.
Wow.
Yeah, and it doesn't just make the team feel better, though morale does improve. It leads to measurable improvements in patient outcomes, too.
So if an organization wants to set up these high-performing teams, what are the first key steps, the best practices to follow right at the beginning?
Okay, several really important things early on. First, you absolutely need a solid needs assessment. Figure out exactly what quality gap or performance issue you're trying to fix. You need that clarity.
Know the problem before you try to solve it.
Precisely. Then, engage stakeholders early. Anyone who's going to be affected by the team's work, get their buy-in, make sure everyone understands the goals, the expectations. Super important for smooth sailing later.
Makes sense. What else?
Define clear criteria for who should be on the team. You want diverse perspectives, different expertise. That's a strength. And finally, establish a formal charter. Think of it as the team's foundational document. It lays out the purpose, the scope, everything.
A charter. Okay, that sounds pretty official, more than just a handshake
Oh,
agreement.
yeah, much more. And central to that charter is the problem statement. If you get the problem statement right, really well crafted, it gives the team incredible clarity and focus, helps ensure you're aiming for results you can actually measure.
How do you make a problem statement effective?
Parker's work from 2024 breaks it down nicely. You need the what is the problem? Like high rates of hospital-acquired infections, the who's affected, ICU patients maybe, the when does it happen, shift changes, the how often, what's the scale, 10 incidents a month.
Wow, super specific.
Yeah, and it goes further. Potential causes, maybe poor hand hygiene, and the impact. What are the consequences? Longer stays, higher costs, patient harm.
That is incredibly detailed, almost like a diagnosis for the problem itself. You even have an example here. The emergency department experiences a 20% rate of medication errors during night shifts, primarily affecting elderly patients due to incomplete handoff communication, resulting in delayed treatment and increased patient harm. That makes it so real.
Exactly. And that kind of precise problem statement then feeds directly into the broader team charter. The charter essentially formalizes that problem and sets up the whole operating framework for the team. It's like the team's rule book or constitution.
So what goes into this charter, besides the problem statement?
Key elements include a clear mission statement, short, punchy, says what the team's about, then goals and objectives, and these should be smart, specific, measurable, achievable, relevant, time-bound.
Smart goals, right?
Yeah. Then scope, clearly defining what the team will tackle, and just as importantly, what it won't tackle. Team composition, who's on the team, what are their roles, leader, facilitator, sponsor members, resources, what support does the team have, and finally, a timeline, often using a Gantt chart.
That bar chart thing that shows tasks over time.
That's the one. Really helpful for visualizing milestones and deadlines.
So the charter isn't just filed away, it's an active guide.
Absolutely. Research, Johnson and Lee in 2024 really stressed how charters stop scope creep, where the team starts drifting off mission. It keeps everyone focused and aligned. It's a communication tool, too.
And they're tools to help build these charters.
Yeah, things like SWOT analysis, strengths, weaknesses, opportunities, threats, helps assess the situation. Stakeholder mapping helps figure out who has influence and interest. And those Gantt charts for the timeline management.
Okay, teams formed, problems defined, charters in place. Now, how do they actually, work together day to day? Ground rules seem pretty important here.
Oh, fundamental. Ground rules are all about creating that respectful, collaborative space where people can actually get stuff done. They're the agreed-upon ways of behaving that help the team function smoothly.
What kind of ground rules usually work well for these teams?
Taylor and Brown's work from 2023 listed some common, effective ones. Punctuality, huge respect thing, starting and ending on time. Active participation, everyone needs to chip in. Respectful communication, valuing opinions, no interrupting, keeping it professional.
Basic manners, almost, but formalized.
Kind of, yeah.
Yeah.
Also, managing devices, minimizing distractions from phones or laptops. Confidentiality if sensitive stuff is discussed. No side conversations during meetings keeps everyone focused.
Yeah.
And having some flexibility built in because life happens.
It seems like common sense, but writing them down probably prevents a lot of friction, right? How do teams actually put these rules into action?
Best way, develop them collaboratively. When the team helps create the rules, they own them more. They're more likely to stick to them.
Makes sense.
Also helpful to have visible reminders, maybe post them in the room or put them on agendas. And if someone slips up, the leader or facilitator needs to gently remind everyone, hey, remember our agreement on?
Okay, got the ground rules set. How do you then build that real team feeling, that cohesion that's so critical for tackling tough healthcare problems?
Yeah, building cohesion, that sense of trust, openness, mutual support is absolutely vital. Team orientation and education are key here. These sessions aren't just about understanding the team's purpose and goals, though that's important.
What else do they do?
They help clarify everyone's individual role, who's doing what, and really importantly, they give people a chance to build relationships. Get to know each other as people. That personal connection is huge for collaboration and building that shared commitment.
And it's not just about feeling good, is it? Cohesion actually impacts results.
Big time. Research by Purcell and others in 2024 found that highly cohesive teams are significantly more likely, like 30% more likely to hit their targets. That's substantial.
Wow. So how do you foster it?
Can be simple things. Icebreakers at the start, workshops focus specifically on role clarity, team building exercises designed to build trust and communication skills.
And the education part of orientation. What kind of learning happens there?
Key principles here are fostering openness, creating psychological safety so people feel okay sharing ideas, even disagreeing without fear. Building trust and encouraging, appropriate self-disclosure helps with that safety.
Psychological safety, that term comes up a lot.
It's huge. Also, cultivating a supportive culture where people help each other out, celebrate wins together, and providing actual training in things like conflict resolution, because disagreements will happen. Equipping the team to handle them constructively is crucial.
Are there specific tools for this kind of team education?
Definitely. Tools like psychological safety assessments, Google's Project Aristotle work looked into this. The TeamStep PS training program, which we'll probably talk more about, is specifically designed for healthcare teamwork. And even simulation-based learning, where teams practice collaborating in realistic scenarios. All really valuable.
Okay, so the team's cohesive, they have rules, they're oriented. Now they need a system, a model, to actually do the improvement work. What frameworks do healthcare organizations use?
There are several really well-established models. Probably the most famous is PDCA, Plan, Do, Check, Act. It's a cycle. You plan a change, try it out small, check the results, and then act based on what you learned. Simple, powerful.
The classic improvement cycle.
Exactly. Then there's Lean Six Sigma. That's often more comprehensive. It focuses heavily on removing waste from processes and reducing variation inconsistencies to boost efficiency and quality.
Lean for waste, Six Sigma for variation.
You got it. And another big one is the model for improvement. It frames things around three key questions. What are we trying to accomplish? How will we know a change is an improvement? And what changes can we make that will result in improvement? It really pushes for clear aims, good measurement, and iterative testing of changes.
Sounds like different tools for different jobs, maybe. No single best model.
That's often the case. And interestingly, Kumar and Patel noted in 2024 that we're seeing more hybrid approaches, like combining lean principles with PDCA cycles. These mixes can be really effective for complex problems, say trying to reduce hospital readmissions, where you need both process streamlining and rapid testing.
Okay, so whatever model they pick, what are the usual steps the team follows in the improvement process itself?
Generally, it starts with solid project planning. Setting out a timeline, identifying the deliverables, what will the team actually produce, and assigning roles. Who's responsible for what?
Getting organized.
Right. Then comes data collection. This is critical. You need both quantitative data numbers, like infection rates, and qualitative data, things like staff feedback from surveys or interviews, maybe insights from digging into electronic health records, EHRs.
Numbers and stories.
Both are vital. Next up is data analysis. Using statistical tools, control charts to see variation over time, Pareto charts to find the biggest causes, things like that, to spot trends, patterns, root causes, and bringing in different perspectives from the team here is gold.
Get multiple eyes on the data.
Exactly. Once you think you understand the causes, you move to intervention selection, brainstorming solutions. Could be simple, low-cost things, could be bigger system changes. Really important here to involve the people who actually do the new process, get their input, their buy-in.
Makes sense. Then what?
Implementation. Often starting with a pilot test, try the change on a small scale first. See how it works before rolling it out everywhere. And during implementation, you need real-time data monitoring. Track progress, watch for unexpected side effects.
Keep checking as you go.
Constantly. Finally, evaluation. Measure the outcomes against where you started, did the interventions work, and then crucially, sustainment. How do you make the improvements stick? That often means new training, maybe updating policies, building it into the regular workflow.
And throughout all this, are there specific tools teams use to keep things on track?
Oh yeah, definitely. Gantt charts for planning and tracking, as we mentioned. Fishbone diagrams, those Ishikawa diagrams, are great for brainstorming all the potential causes of a problem. And run charts are super useful for plotting data over time to see if your changes are actually making a difference visually.
Now, during this whole process, teams have to make decisions. That can get tricky with different opinions in the room. How do they handle that effectively?
Yeah, decision-making is key. Teams use various methods. Sometimes it's straightforward voting, maybe in the room, maybe email, maybe multi-voting where you narrow down options.
Quick and simple sometimes.
Right. But for tougher stuff, more complex issues, consensus building is often better. That means facilitated discussion aiming for general agreement where everyone feels heard and can live with the decision, even if it wasn't their first choice. Takes skill to facilitate that well.
I can imagine. Any other methods?
There's the Delphi technique. That's interesting. You get anonymous input from experts over several rounds, helps reduce bias from, dominant personalities or groupthink. And Winyan and Carter's 2023 research actually pointed to hybrid approaches, again, maybe combining some voting with consensus discussion to be both inclusive and efficient.
Consensus sounds ideal, but yeah, sounds challenging too. Diverse views, time pressure.
Definitely challenging. That's why good facilitation is so crucial. A neutral guide to keep the discussion on track, make sure everyone contributes, navigate disagreements constructively. Also helps to set clear decision-making criteria before you start debating options. Like, what's the potential impact? What's the cost? How easy is it to scale up? Gives the discussion focus.
And having feedback loops.
Yeah, checking back later. How did that decision actually work out? Do we need to adjust? Keeps the process dynamic.
You mentioned TeamStep PS earlier. It sounded like a really comprehensive framework. Can you tell us more about how it boosts teamwork and communication?
Yeah, TeamStep PS, team strategies and tools to enhance performance and patient safety. It's a fantastic evidence-based framework, came out of collaboration between the Department of Defense and AHRQ, the Agency for Healthcare Research and Quality.
Military and Healthcare Quality Agency. Interesting combo.
Right, but it makes sense. Both need high-reliability teamwork. Its whole goal is to seriously improve patient safety by sharpening teamwork and communication skills across the entire healthcare team. Doctors, nurses, techs, admin, everyone.
So how does an organization actually put something like TeamStep PS into practice?
It's usually a phased approach. Phase 1 is assessment. Look at the current situation. Where are the teamwork gaps? What are the communication breakdowns? What are the barriers going to be? Staff resistance, lack of resources.
Got to know where you're starting from.
Exactly. Then comes planning and training. Based on that assessment, you develop a tailored plan. Then you train people using the TeamStep PS tools and modules. Simulation is often big here, practicing scenarios, like using SBR for handoffs.
SBR.
Situation Background Assessment Recommendation. It's a structured way to pass on critical patient information clearly and concisely, really reduces errors.
Okay, so assessment, planning, training, then what?
Sustainment. This is key. You can't just train people and walk away. You need to embed it in the culture. That means ongoing monitoring audits, feedback to see if people are actually using the tools, integrating the principles into policies, procedures, performance reviews, making it the way things are done.
Making it stick.
Precisely. And AHRQ noted in 2024 that there's a growing push to integrate TeamStep PS tools right into digital systems like EHR alerts or prompts, using tech to reinforce good communication habits.
So SBR is one tool. What other key tools does TeamStep PS offer?
SBR is huge for handoffs, yeah. Another really important one is CUS, stands for Concerned Uncomfortable Safety Issue. Yeah, it gives any team member, regardless of hierarchy, a clear, assertive, but respectful script to raise a safety concern. Like, I'm concerned about X, I'm uncomfortable with Y, this is a safety issue because Z empowers everyone to speak up.
That sounds powerful for safety culture.
It really is. And then there are huddles, short, quick, informal team check-ins, often at the start of a shift. Let's align on priorities, flag potential issues, make sure everyone's synced up on patient plans, really efficient communication.
Okay, so the team's done its work, implemented changes using these models and tools. How do you know if it actually worked? How do you evaluate the team's performance?
Great question. Evaluation is crucial for knowing if you made a difference and for learning for next time. You need to ask, did the team hit the goals set out in the charter? Did they stick to the process they planned to use? Were individual members accountable for their parts?
Makes sense. Are there specific tools for measuring that?
Yeah, several useful ones. There's the Team Effectiveness Evaluation Summary from the University of Minnesota, updated in 2023. It looks at a bunch of things: team vision, roles, processes, relationships, outside influences, outcomes, behaviors. Really comprehensive.
Yeah.
Another tool is the balanced scorecard approach. Lets you track metrics across different areas, clinical outcomes, operational efficiency, team dynamics itself. Gives a broader picture. And 360-degree feedback is also valuable, getting input not just from inside the team, but from leaders, maybe other departments they worked with, gives you multiple perspectives.
So it's not just about the final result, but how the team functioned too.
Exactly. An evaluation isn't just a one-time thing at the end. It should feed back into the continuous improvement loop. Use the findings to make the next team process even better. Document those lessons learned, share them widely. That's how you build a learning organization.
We focused a lot on the teams themselves, but a lot of their work happens in meetings. How can organizations make sure meetings are actually productive, not just, time sinks?
The meeting challenge. Yeah, effective meeting management is vital. Lobby's 2024 work really nails it. Every single meeting needs a clear purpose. Are we sharing info, making a decision, getting feedback? Knowing the why is step one.
Different types of meetings for different goals.
Right. You got your informational updates, your decision-making sessions, your brainstorming or feedback meetings. The format should match the function.
So what are the absolute must-dos for running a good meeting? One that people don't dread.
Okay, fundamentals, clear objectives, everyone knows why they're there. Targeted invites only the people who need to be there. A structured agenda with time estimates sent out beforehand. Huge for focus.
The agenda is key.
Absolutely. Good time management during the meeting. Start on time, end on time, keep things moving, respect people's schedules, minimize distractions, maybe a lids down rule for laptops sometimes, and prompt follow-up. Action items, minutes distributed quickly. That ensures things actually happen after the meeting.
Sounds like prep work is half the battle.
Easily. Sending reminders with the agenda, making sure presenters are ready, checking the tech or the room set up beforehand, all that smooths the way. Then, during the meeting, kick off by stating the purpose and reviewing the agenda. Keep the momentum going gently. Steer off-topic conversations back. Encourage everyone to participate, but also manage folks who might dominate the conversation.
Got to draw out the quiet ones and manage the talkers.
Skilled facilitation right there. And leave time for feedback if needed. Then, the minutes, they're not just notes. Get them out within a week, ideally. Clearly list outcomes, decisions, who's doing what by when, and crucially, add any follow-up items to the next meeting's agenda. Close that loop.
It's fascinating how teamwork in healthcare has shifted. It's really moved beyond just individual experts working alone, hasn't it?
Oh, completely. The old model of siloed departments, doctors doing their thing, nurses doing theirs, that's largely given way to interdisciplinary teams, intentionally bringing together clinical folks, non-clinical staff, everyone with relevant expertise.
And that shift has made a real difference.
Huge difference. This collaborative approach is essential now for managing complex care, reducing errors, especially during handoffs or transitions, and ultimately getting better patient outcomes. It's just a higher standard of care.
What makes these effective healthcare teams really tick? What are their defining traits?
You usually see strong interdependence members know they need each other's skills and input. Diversity is key, too. Different backgrounds, different ways of thinking bring richer solutions. And underlying it all is a shared commitment, a real dedication to the quality improvement goal and to patient well-being.
We mentioned Tuckman's model earlier, forming, storming, norming, performing. How does that usually play out with these QI teams?
Tuckman's model is a really useful way to think about team development. Forming is that initial stage, getting to know each other, figuring out the task. Storming is often next. That's where conflict can emerge as different styles and opinions clash. It's natural, but needs managing.
The tricky phase.
Can be. Then, hopefully, comes norming. Cohesion builds, the team figures out how to work together, establishes ground rules implicitly or explicitly. And finally, performing the team is running smoothly, focused, productive, getting things done.
Does it always go in that order?
Not always so neat. Davis and Kim's 2024 work pointed out that teams can sometimes get stuck, or even cycle back through stages. Maybe a new member joins, or the goal changes that can send a team back to storming or norming for a bit. It's dynamic.
Okay, we know why teams are important and how they work. Are there different kinds of QI teams you see in healthcare?
Yeah, quite a variety, tailored to different needs. You've got functional teams that usually focus on processes within one specific department, like an infection control team within nursing.
Okay.
Then cross-functional teams. These bring people together from multiple departments or disciplines to tackle broader issues that cut across areas, like improving overall patient flow from admission to discharge.
Tackling bigger system problems.
Exactly. Clinical teams often focus on care for specific patient groups or conditions, maybe a diabetes management team. Operational teams work on the non-clinical side, things like supply chain efficiency or patient billing processes.
Important behind-the-scenes stuff.
Vital. Ad hoc teams are temporarily formed for a specific short-term task, like investigating a particular safety event, and then they disband. And you also see self-directed teams. Sometimes they have more autonomy to manage their own work within certain boundaries.
And within these teams, people usually have specific roles, right?
Mhm.
Like leader, member.
Absolutely. Key roles usually include the team leader. They facilitate, delegate, keep the team aligned. Needs good communication, organization, conflict skills.
A conductor, kind of.
Good analogy. Then team members, they bring the expertise, engage actively, respect different views. Good listening, collaboration, commitment are key there. The sponsor is usually a leader higher up, provides oversight, secures resources, ensures alignment with organizational strategy. They champion the team's work.
The crucial link to leadership.
hmm And often there's a healthcare quality professional involved. They might coordinate the process, help with QI methods and tools, maybe facilitate training, act as a resource on improvement strategies. They bring that specific QI expertise.
This has been incredibly insightful, really getting into the nuts and bolts of healthcare QI teams and meetings. It's so clear that improving care isn't just about protocols. It's deeply about how people collaborate effectively.
Absolutely. Guided by structure, driven by data, committed to getting better.
Yeah, effective teams,
Yeah.
well-run meetings, frameworks like TeamStep PS, solid processes. They're the engine room, really, for continuous quality improvement in healthcare.
Hmm.
Understanding this gives you, the listener, such a valuable window into how healthcare is constantly striving to do better.
Couldn't agree more. It's about building that culture where improvement isn't a project, it's just how things are done, where safety and quality are everyone's focus, supported by these team structures and processes.
So as we wrap up, here's something to think about. We've talked about healthcare, but these ideas, team dynamics, effective meetings, structured collaboration, they apply everywhere, don't they?
Oh, universally. Any field tackling complex problems needs this kind of teamwork.
Right. So thinking about your own work, your own context, whatever that might be, what one key takeaway from this discussion you could potentially apply? It really highlights the power of getting collaboration right, doesn't it? Something to chew on.